Hello, welcome. Welcome. We'll let folks start to trickle on in. Welcome. Feel free to get settled if you'd like. I welcome you to introduce yourselves in the chat. And we'll get started in about a minute or so. Let's let folks get on in here. Hi, everyone. Welcome, welcome. Feel free to come on in and get settled. Feel free to introduce yourselves in the chat. We're just letting everybody get in here. We'll begin very shortly. Good morning to all of my West Coast folks. Good afternoon to folks like me, either on the East Coast or Central. So great to see you all, at least from the standpoint of your participant list and your comments in the chat. Hopefully one day soon we'll get to see each other in person. All right, so as you all get settled, feel free to continue introducing yourselves in the chat. I just want to go ahead and get started in the interest of time. So hi all, and welcome to the Black AIDS Institute's Brown Bag Lunch Series. We are extremely excited that you're able to join in. My name is Tanisha Lewis, and I use she, her pronouns. I'm BAI's Senior Manager of Training and Capacity Building. So BAI's mission is to stop the HIV/AIDS epidemic in Black communities by engaging and mobilizing Black institutions and individuals to confront HIV. We advance this mission with activities like our Brown Bag Lunches. And every month, we're bringing in folks who can speak to HIV-related issues facing Black Americans. So this month, though, we're highlighting the relaunch of our well-known African American HIV University, also known as AAHU. So for over 2 decades, BAI has led the fight against HIV in Black communities by building the capacity of the HIV workforce. And AAHU, which has been around since about 2001, but has been paused in recent years as BAI has grown and evolved, has now undergone a refresher for this 2021 to 2022 academic year. And in my role here at BAI, I oversee all of the educational efforts, and that includes AAHU. So I'm going to share some words about AAHU, and then we'll have a Q&A period. So for our Zoom viewers, please feel free to ask questions using our Q&A button, and that's located at the bottom of the Zoom screen. You may have to hover your cursor over to see it. And we'll have time to address your questions following the presentation. So with that being said, let's dive in. And just FYI for our Zoom viewers, I may or may not be able to see your chat. I'm going to do my best, but if you have questions or even comments, feel free to include them in the Q&A feature, and then you can also discuss amongst yourselves in the chat. All right, so we're just going to dive right in. All right, so our objectives today are really, really simple. We are going to discuss the state of HIV among Black Americans. We're going to talk about strategies for addressing HIV disparities among Black Americans, and we're going to explore the HIV University here at BAI. Okay, so as I just mentioned, the Black AIDS Institute's mission is to stop the HIV/AIDS epidemic in Black communities by engaging and mobilizing Black institutions and individuals to confront HIV. And since 1999, BAI has educated health department staff, peer educators, community organizations, and public health professionals all to act upon ending the HIV epidemic in Black American communities. And we'll see why that's so important right now. So the good thing is that it's 2021 and today's medicines have helped to prevent the transmission of HIV and to reduce its progression. And with medical adherence, so folks sticking to their medical regimens, many people living with HIV can expect lives as long as people who do not live with HIV. And the risk of transmission is often less than or equal to 1%. That's great news. But we've got a problem. HIV continues to be a public health crisis in Black America. So even though Black Americans make up 13% of the U.S. population, Black Americans comprise over 40% of people living with HIV. So what does that look like in practical terms? So if I have a room of, let's say, 100 people, 100 Americans, 13 of them are expected to be Black Americans. If I take another room of 100 Americans, this time Americans living with HIV, 42 of them are expected to be Black Americans. So even though that first room had 100 Americans with 13 folks identifying as Black, that second room of Americans living with HIV, 42%, a non-proportionate amount, are living with HIV and are Black. Similarly, if I have a third room with 100 Americans, this time folks who have been newly diagnosed with HIV, 42 of them would be Black. So that's clearly not an equal amount across the board, and it is clearly a disproportionate amount. So further, these disproportionate effects are especially seen among folks who identify as both Black and either gay or bisexual men, as approximately 1 out of every 2 Black, gay, or bisexual men is estimated to acquire HIV during his or their lifetime. 1 out of 2, that's half. Of Black people living with HIV, 85% are aware of their status, but just under half of them are retained in care. So 85% are aware. Yes, we've got a ways to go, but that's pretty good. But under half are retained in HIV care. That's the real problem there. So what can we do about this? Well, to tackle these disparities, first, we can think about what drives these disparities. And we've got these things called social determinants of health. So my background is in public health and public health equity, so I could really nerd out on you here. But basically the gist is, if we focus on only these biomedical advances, these wonderful treatments that have been developed and that we have here in 2021, if we only focus on that, that's not enough. That is not enough that will to end the HIV epidemic. We have to also take advantage and acknowledge these systems level issues like your neighborhood, education, food security, and healthcare, and that are all linked to how long and how well someone lives. That's your quality and quantity of life. And so most importantly, though, with respect to Black Americans, we've got to take this in the context of over 200 years, so approximately from 1619 to 1865, of chattel slavery, and another 100 years of governmental policies like redlining that restricts the access to generational wealth. That resulted in a domino effect that many Black Americans face in dealing with disproportionate health outcomes like HIV. Okay, so we've got to address all of these social determinants in order to even get to the point of ending HIV. So BAI took the stance of, along with the CDC, the Latino Commission on AIDS, the National Alliance of State and Territorial AIDS Directors, Johns Hopkins University, and Janssen Therapeutics, to take a look at the HIV workforce. Because we know in order to make a real difference with all of these issues, we need a strong HIV workforce. And so BAI conducted, along with all of these entities that are previously named, a web-based survey. And they rolled out the findings in their 2015 annual report. So there you had more than 3,600 HIV/AIDS respondents from 48 states, DC, and U.S. territories who completed a 62-question web-based survey. And the survey results were pretty concerning. So on average, the folks from the workforce who responded only answered about 63% of survey questions correctly. And these survey questions were meant to test basic scientific knowledge about HIV and beliefs. So that 63%, that is pretty much a D grade as far as HIV science and treatment is concerned. It's a D. Participants were also more likely to answer basic science questions with like a 76%, which is a C grade. And then on treatment-related questions, participants only got about 56% correct, which is an F grade. So basically, the survey of the HIV workforce has folks responding to these knowledge questions at about a C, D, and F average. And this is basic knowledge about science, HIV, how to treat. So that presents a problem. Also, respondents appeared especially ill-prepared to assist folks living with HIV and at risk of HIV infection as far as biomedical prevention tools like PrEP and treatment as prevention. The questions that were relating to those biomedical tools, folks received on average about a 46, which is a pretty bad F. So all of this indicated a clear need for continued development and support of the HIV workforce. If we fast forward from 2015 on till today, quite literally this year, in March 2021, the CDC had a review team that analyzed all 32 of the Ending the HIV Epidemic jurisdictional plans. And in April 2021, they analyzed those reviews for themes, and they presented them this month in June. So this is fresh information. So common themes, they assessed the workforce and some of the needs that the workforce had. Common needs included the need to increase the amount of social workers, community health workers, PrEP navigators, everyone who comprises this workforce, who makes the backbone of the workforce. We need more people there. Also, the EHE jurisdictions indicated that increasing the capacity of the HIV workforce is essential in order for them to successfully expand service delivery hours, in order to strengthen the partner services and improve the data to care efforts. And then also those EHE jurisdictions also noted the need for the HIV workforce to reflect the communities that it serves, as well as to be trained in cultural competent, trauma-informed, sex-positive, and gender-affirming care. So these are needs that came directly from this HIV workforce. Many of us are probably already part of this and already know this, but just so that we can have that common understanding. This is what the HIV workforce says it needs. So what do we do about that? Well, BAI has responded to all of these issues, the workforce issues, the social determinants of health issues, the disparity issues, all of this, with its We the People response. It was launched in February 2020 first, and then again in February 2021, in order to coincide with the National Black HIV/AIDS Awareness Day. So this We the People strategy is a framework with 4 pillars, and basically it's 4 ways in which we can all enact policy to address HIV in Black America. Because based on what we saw with the data earlier, if we address HIV in Black America, then we can make a significant impact on HIV in all of America. And listed here are our 4 pillars. If you'd like more information about this, feel free to visit our website, blackaids.org, and the entire plan itself is listed there. I've got a question about will we have access to the slides and the recording? Yes. So if you'd like access to the slides, you can email me. I have my email at the end, and I'll also briefly type it for our Zoom folks right now. And then the actual recording itself will be available in about a week on our YouTube channel at Black AIDS. Okay. And so with this AAHU model, which is what we're talking about today, we are educating on all of these 4 pillars, and we're working toward achieving each one of them, as well as giving the workforce the support that it needs to achieve each one of these pillars. So we built up a decent background of what's going on, particularly in Black America, why this is so important to ending the HIV epidemic overall, and what BAI has begun to do about it. So let's actually jump into the AAHU model to see how it works hand in hand with the We the People strategy to fight HIV. All right, so part of this response is the AAHU model. And so, like I said, we're educating on all 4 pillars, and it began in 1999 with the 1999 to 2001. It was in development, and then the last official cohort came through in 2016. So we've been out without it a few years, and in that time, we've had a transition from our former CEO and founder to our current CEO, Rania Copeland. And so with all of that, BI has developed and grown, and now we are ready to relaunch. So the African American HIV University, or AAHU, is BAI's comprehensive training and leadership development initiative. It's designed to increase knowledge, to decrease stigma, and to strengthen workforce capacity and engagement, which is ultimately to address and end the HIV/AIDS epidemic in Black American communities. So really, it's the response to the call from what the workforce says it needs, what we found in the previous survey that we discussed, and what the disproportionality says in science. What is this model? Well, we've got 7 components that currently comprise AAHU. So first, we've got our 2 flagship programs. These programs have been in existence pretty much the duration of AAHU, so that's just about 20 years or so now. We've got the Science and Treatment College and the Community Mobilization College. We'll touch on them briefly in our next slide, so I won't go over them too much now, but they're basically academic year-long programs from September to May, and they are to educate the community and workforce in the science of HIV, as well as in community engagement initiatives, ultimately culminating in folks being able to do needs assessments and to really survey community, engage policymakers for advocacy, things like that. We also have an abbreviated version of those 2, and that's the HIV Workforce Certificate Program. This is about a 20-hour or so program that touches briefly on the flagship program components, but is ultimately a fast-paced way to get similar amounts of information. Okay. Then one huge part of what the AAHU model is our training and capacity building outreach and consultation component. And so there we're working with EHE funded jurisdictions, health departments, universities, and other institutions like churches and community organizations. And we're basically providing technical assistance. We are providing facilitation and trainings, and we'll go into that in a little bit as well. We also, through this component, do things like this, our BBLs, or our Brown Bag Lunch Series. And this is the outreach that we're doing, trying to get information from research avenues and from these institutional entities to everyone who has the ability to just log in and view. We also have a component, which is our biomedical research education component. And this is the component that takes conferences like CROI and other really science-heavy conferences and initiatives and turns all of that information into something that anyone can understand. Anyone who has a heart to make change can understand. So you can tune in for certain BBLs, which are focused on this biomedical research. You can tune in to one of our initiatives every Wednesday. We have something called Wake Up Wednesday, where we're teaching folks about medical mistrust. We're combating that, learning about COVID-19 and HIV and different emergent trends with respect to those 2. And just really to get a way to understand, have a way to understand that really technical, sciencey information, right? We also have 2 networks. One is our Black Executive Director and CEO network, where we're reaching out to Black-led organizations and really providing a support network for those leaders, connecting them to one another as well as to other resources to really strengthen them. And then we have our alumni network. So everyone who participates in our cohort programs, like the Science and Treatment College and the Community Mobilization College and the HIV Certification Program, they are invited once they complete the program to join other alumni to connect with one another for engagement and mentorship. And we are having them do reunions and really just form a bonded network so that they can grow together and help each other in strengthening the HIV workforce. Right. And so currently, the AAHU model is reaching about 3,000 people annually across our trainings and webinars, but that doesn't even count the reach from our online informational materials and even things like this BBL. We're reaching over 200,000 people across our website and social media. Our cohorts for the Science and Treatment College and Community Mobilization College, they reach about 30 scholars each per year. And then our BBLs are about 772 folks. And then we reach about 2,000 HIV workers annually as well through designated training. So that was a mouthful. So what we'll do is we'll dive into those two flagship programs really quickly, just because, and I'll talk about this in a bit, but we're actually launching the application process for this tomorrow morning. And so for our viewers who are not on Zoom, that's June 25th, the morning of June 25th. All right, so the STC and the CMC are year-long cohorts. Like I said, they're academic year, September through May, meant to develop and build capacity in the HIV workforce. The content is delivered both asynchronously and synchronously, so that's, we're sitting together in a Zoom webinar, or you're doing the work on your own. And then once the world opens up a little bit more, we'll also have more in-person components as well. To include an in-person graduation where you'll be introduced where our folks will be introduced into the AAHU alumni network as well. So it's a really fun opportunity. Scholars will be able to meet virtually at the beginning and end of each module to touch base about what the material is, as well as to gain any sort of clarity that's needed. And then the asynchronous or offline on your own material, that's pretty much viewing the didactic section, so the lectures from our expert faculty members, to include our scientific advisory committee, who is delivering this content to folks. All right. And then we have, as I stated, a graduation. So in the graduation, scholars are presenting their end product. So during the entirety of the program, folks are working together and individually toward an end goal. And so that is either a program plan, if the person is in the Science and Treatment College, or it's a needs assessment and logic model if the person is in the Community Mobilization College. So even if if we have a scholar who is sponsored by their workplace, this could be a really good way to come out of this program with something tangible that can be utilized for the work. So this slide is pretty much shows the parallels and the differences between the two flagship models. So both models consist of 4 8-week modules, and pretty much the Science and Treatment College is science-based. It's heavily in science. It's epidemiology, the pathology of HIV, it's how to read lab reports, how to develop a science-based program plan to address a certain issue in a scholar's community. And the Community Mobilization College is also 4 8-week modules, but these are based on grassroots organizing. So knowing the background of HIV/AIDS in Black America, how to leverage the information that you have to get the community going and to empower the community, ultimately ending in creating a needs assessment and logic model for the community. So with excitement, I can announce that we have everything opening up in the next 24 hours. And for those viewers who are not viewing on Zoom, will probably open by the time you're able to see it. I've got a question here that I'll answer in the chat. It says, is there space or room for folks who may be focused on HIV policies, or which track would you recommend? I would say both could be appropriate, though I would recommend, if you are seriously focused on HIV policy, to do the Community Mobilization College. We talk a lot about policy. I'm diving into our We the People plan, which is all policy. All right. So once again, super excited to let you all know that we have our cohort applications that are open. The HIV certification program is in a pilot form right now, and we are accepting about 20 more people. 20 more people who can go through this pilot. We are also accepting beyond that any interested individuals who will be waitlisted for the full programs roll out later in the fall. So if you don't make that 20% cut, it's okay. We'll just add you to the wait list, let you know you're added to the wait list. And when the full program is rolled out in the fall for this abbreviated program, you'll be able to join. All right. And then the Science and Treatment College and Community Mobilization College are open as of 8 a.m. Eastern Time on June 25th. All right. And they will continue to be open until August 15th of 2021. So summertime period. So anybody who is viewing this on Zoom will get an email to this application on tomorrow. And anyone else watching, you will be able to go to our blackaids.org website, go to our AAHU page, and the application will be there. And if anyone has trouble or needs assistance in any way, please feel free to email me. Okay, so just as an FYI though, the application is going to include contact and demographic information, some short answer questions, as well as an essay, which can be either written or recorded on video. And so we ask that applicants also have 2 references submit recommendation letters separately via email. And all of this information, these instructions are detailed on the applications. And so, like I said, the application cycle for both of these programs, the CMC and the STC, goes through mid-August, August 15th. And then the rest of August is dedicated to reviewing these applications. And then acceptances or wait lists will be rolled out in early September. And courses for the 2 flagship programs will begin in late September. For the HIV CERT pilot, that official rollout is to be determined just because we're still in the pilot phase and we need time to evaluate and make adjustments as needed. But if you would like more information, please feel free to sign up for our email updates. If you go to our blackaids.org website and scroll to the bottom, you'll be able to subscribe for more information. So at this point, we've talked a lot. We've talked a lot about the AAHU model and some of the cohort programs, but what we haven't yet touched on is the training and capacity building component. And so what does that look like? So we've got 3 things that we're doing here at BAI. We've got facilitation, technical assistance, and training. For the facilitation portion, we are walking folks through issues like having focus groups and a consensus workshop. So if you are working with other organizations or even the community and you want to come together in agreement on a topic or on a strategy, we can help you do that in a concise way. We can also help you do action planning workshops, and we provide technical assistance for these things as well. So we can help facilitate them, and we can also do them for you too. For the training portion, though, this is how we teach you to do that stuff. So we can teach program planning, program implementation, medical mistrust, and racial equity. We teach on gender, sex, and sexuality, how to reduce stigma in the community, and creating needs assessments. So think of this training as little pieces of those cohort programs, just little one-off pieces of them, where you can reach out to us and we can develop a custom plan, a training plan for a team, a department, or even an entire organization around certain trainings. So if you don't quite have the capacity to participate in the entire AAHU program, then we can take pieces with this training and help you. Or if you find that having us just facilitate or hand hold a little bit in the facilitation and technical assistance aspects is a little too much, we can also train you and provide extra support there too. I've got a question in the chat that says, when will HIV Workforce Certification Program begin? And I think I might have answered this one. I probably just didn't see the question before I answered it. Just to be determined right now, just we have to wait until we see the results of the evaluation of the pilot. So we've done a lot. We've talked about the disparity seen in Black America with regard to HIV. We've talked about some of the strategies that BAI is taking on to include the We the People plan and our AAHU model. So now what can we do with all of this information? One is remember that Black Americans are impacted disproportionately by HIV. And it's not just enough to utilize all of these new wonderful technologies. that's just not enough to end HIV. We must also take into account social and structural efforts. And so at BAI, we're connecting with our stakeholders and partners, and we're training community members, and we're building workforce capacity using our AAHU model and the We the People strategy. And with excitement, the application cycles for the pilot, as well as the Science and Treatment College and the Community Mobilization College are all opening. And so lastly, if anyone would like specific training and capacity building help, we provide consultation as well for AAHU funded jurisdictions, for health departments, and other community organizations and entities who want to do and who are already doing the good work of working toward ending the HIV epidemic. And so I'll leave this last slide up here for a moment as I go and I address the questions in the Q&A. My contact information is Tanisha L at blackaids.org. If you'd like more information about the pilot, though, please reach out to our Special Projects Manager, Maya Merriweather, at mayam@blackaids.org. And then you can also follow us online at blackaids.org on Facebook, Instagram, and Twitter. And feel free to sign up for our email address, for our email updates at the end of our, at the bottom of our webpage. Okay, now I'll leave the slide up here for just a bit. So I've got a question, and while I'm reading this question, folks can feel free to chime in with any other questions or comments, either in the Q&A section or on the chat. I can see both right now. This first question says, what is your suggestion for a long-term survivor who is retired from working and now has time to work in the HIV communities? How many students do you have in their 60s? I love this question, and I am so grateful that you have asked this question. We have students across all age ranges, from 18 on up. So feel free to engage in this program. We are anticipating anywhere from 3 to 5 or so hours per week for those big flagship programs, the Science and Treatment College, as well as the Community Mobilization College. And so that goes each week from September through May. You take your time and complete the offline work as you're able. And then we have just 2 meetings where we're meeting on Zoom to touch base for maybe about an hour and a half or so. So it's a very low burden sort of set of programs. And then if you want something a little bit more abbreviated and a little faster paced, we do have the 20-hour HIV CERT program that you can go through on your own time as well. It's self-guided. So I recommend that you take advantage of any of them. I think it's perfectly acceptable. There is no age restriction. There is no desired age range. We're even engaging college students as well. Thank you for that. I also have a question that says, are you going to bring back in-person seminars for the CMC and STC? So, short answer, yes, for sure. Right now, we're still, of course, in the midst of the global pandemic, so we can't do as much as we would typically do. Historically, BAI has done like 30-day in-person sessions or week-long in-person sessions. And while I don't foresee something as long as that going on, we fully anticipate taking advantage of things like conferences, which are already in place, having folks come out and conducting modules during a conference. And then, of course, we're going to have our presentations at the end of the program. They're going to be in person as well. So we will for sure get in-person time. And then as we move further and further out from the pandemic, we'll be able to do more and more. Thank you for that. I also have a question that says, how important is it to include substance use and HIV as a component in AAHU? Mental health is often mentioned, not concerning substance use. I'm very glad you asked that question, and primarily because prior to being at BAI, I worked for a local behavioral health authority. I'm in Central Virginia, and my main task was to address mental health in all of its forms in Central Virginia, and that includes substance misuse. And so it is a personal passion of mine to include, whenever we're talking about mental health, issues of substance misuse. We're not just talking about depression and anxiety, but substance misuse is a mental health concern. It's a mental health issue and it should be treated as such. So we will fully, when speaking of mental health issues, include substance misuse. Thank you for that. Are there any other questions or comments? And I'll stop sharing in the meantime. Okay. So hearing none and having none on the chat or in the Q&A, we will go ahead and wrap up. So I just wanted to say that I'm thankful for all of you tuning in today. If you'd like to reach me, please do so via email. I left the slide up, but just to reiterate, it's TenishaL@blackaids.org, TeneshaL@blackaids.org. You can also find my information on our blackaids.org website. And once again, recordings from this and all of our other BBL sessions are available approximately 1 week after the live webinar on our Black AIDS website and our YouTube channel. Please be sure to check us out for these webinars every fourth Thursday at 11 a.m. Pacific, 1 p.m. Central, and 2 p.m. Eastern. You can stay updated on our events by following us on Facebook, Instagram, and Twitter at Black AIDS, and by subscribing to our email list at the bottom of our website, which is blackaids.org. Once again, my name is Tanisha Lewis, and I'm Senior Manager of Training and Capacity Building at the Black AIDS Institute. I'm wishing everyone a wonderful end to your week. Please stay safe and please be well.